Our top story this evening, the Centers for Disease Control and Prevention this week added to its list of COVID-19 symptoms, which had already included shortness of breath.
Reporter Travis Breeze is now live in Iowa City, where University of Iowa healthcare workers are noticing dangerously low oxygen levels in some patients.
Ron and Abby, doctors here say they have been seeing those low oxygen levels even in patients that are lacking respiratory symptoms. Luckily, they say they have been monitoring them because they've had other symptoms like dehydration. Healthy people usually have oxygen saturation levels in the high 90s. University of Iowa healthcare doctors say some of their COVID-19 patients are dangerously below that, and it's often a surprise.
We have found that patients have lower oxygen levels than what we would typically expect based upon their disease severity.
Thankfully, other symptoms have sounded the alarm.
It's rare to find patients who are feeling completely normal without any symptoms whatsoever that have dangerously low oxygen levels.
Dr. Bryant says oxygen levels in the 80s means you need to get help. With the majority of UIHC's patients being treated at home, though, they needed a way to monitor it.
This is where the home treatment team comes in and is really instrumental in trying to catch these patients.
Staff tracking patients remotely have sent them kits with a pulse oximeter to check their vital signs. The team has contacted around 300 patients total and says 225 have recovered. Dr. Bryant says they're still collecting data on which symptoms are the most problematic, but things like aches and diarrhea are a signal that your condition is getting worse. Reporting live in Iowa City, Travis Breeze, News 7 KWWL.
Yeah, Travis, thanks. Really interesting stuff there coming out of Iowa City. And by the way, that home treatment team at University of Iowa Healthcare is a team of doctors and nurses who make daily calls. Also on the team, pharmacists who prep those kits which will monitor the condition of a patient.